Hello, my name is Shan Kazani. My student number is 251483. This is the fourth and final assignment for subject SOCQ121, Foundations of Critical Inquiry. My literature review, assignment 3, was on the topic of ginger use in hyperemesis. The reason I chose this topic is because pre- and postnatal care in pregnancy and in maternity is such a great passion of mine. I currently work as a midwifery nurse on a maternity ward in a small private hospital in the east of Melbourne. While at work, I see many women with many different issues and concerns, both pre- and postnatally, and I always wonder, is there an alternative to the mainstream medications that I am giving my patients? Is there an alternative that can provide just as much alleviation to their symptoms, but provide safer and less adverse reactions and effects? Most of the women that I see, prenatally and postnatally, are always concerned about the mainstream medications that I'm giving them, what effect they may have on their body, but mostly what effect they may be having to their unborn child. This is why the topic of ginger use in hyperemesis is so intriguing. Hyperemesis is the medical terminology for severe nausea and vomiting during pregnancy. Hyperemesis is mostly thought of as a first trimester illness, but it actually can go all the way up to full term, about 40 weeks. In many cases of hyperemesis, hospitalization is required. When hospitalized, the patient is put on bed rest, IV therapy is commenced, and medications such as antiemetics are prescribed. Ginger. Ginger is a root or a herb that is typically found in climates with dry and frost-free terrain with warm and slightly wet soil. This can be countries like Asia and India. It looks like a root of a tree. It is brown, slightly reflective in colour. It has small green leaves with very small yellow flowers. The root itself is used for many things like cooking, tea, and medicinal purposes. Because of its large and extensive history with alleviating stomach issues, it has been studied for the use against morning sickness and hyperemesis in pregnant women. I researched 5 trials that tested ginger use against such issues, all of which had extremely similar and wonderful results. I found there were more similarities than differences within these trials. These were the dosages, its success, and the trials tested on women under 17 weeks of pregnancy. The dosages were 250 milligram tablets given orally either at a 6 or 8 hourly intervals. It was found that the most effective dosage was 1 gram per day. All trials had an astonishingly high success rate with 85 or above. Most trials researched, 4 out of the 5 that I researched, were trials against a placebo of lactose. These lactose capsules were given at the same intervals. All trials were conducted under 17 weeks, so halfway through the second trimester and under. And lastly, there were no adverse effects or reactions in the trials. The one trial that did follow up with its clients found that there were no lasting effects. All pregnancies went to term with no abnormalities. All APGAR scores were 9 or above at 5 minutes. The differences amongst the trials were the short assessment period, the small groupings, and that all trials at the end stated that more research is needed. The short assessment assessment period went for 1 week or below, which means that the longer adverse reactions or effects of the ginger use were not documented or monitored. Small groups were of 100 participants or lower, and due to the above, more research in this topic is definitely needed. After learning about ginger use in hyperemesis, I believe that twice daily dose of approximately 500 milligrams, totaling to 1 gram daily, is the most effective. So this means a dose of 500 milligrams in the morning and a dose of 500 milligrams at night. My lingering question, and an area that I am very interested in looking further into, is the comparison of the mode of ginger, whether it's ginger capsules or ginger tea. Which one would be more effective? Thank you so very much for listening to my last assessment, and thank you very much for this topic. I found it greatly interesting and greatly used with all my other subjects. Thank you so much.